I'm Dr. Peacock. I wanted to talk to you today about treating metatarsalgia and show you a patient and how we treated this. When she came to see us, you can see she has a lot of issues with her second toe. As a matter of fact, she had dislocation of the second metatarsal phalangeal joint. This is something I do when I test for patients with this. I press up on their third, fourth, and also second toe, and the attitude of the foot would be on toe off. You can see where we have blanching underneath the foot, and these are areas where you have increased metatarsal pressure. Here's how our x-ray looked. You can see she had a lot of pain in the second, third metatarsals, and she has complete dislocation of the second metatarsal phalangeal joint. And the way we addressed this, we did this through minimally invasive surgery. We did osteotomies on the second, third, and fourth metatarsals by percutaneous metatarsal osteotomies. We also performed ischium hammer toe corrections with a double osteotomy on the second toe, single osteotomy on the third and fourth toes and the proximal phalanx. In addition to this, we performed what we call a Haspel procedure, which diminishes the width of the second metatarsal. Now, this type of surgery, you go through quite a bit of recovery, so she had months of pain, mostly dorsal from this. But we do allow the patients to walk on this so that the bones find their own level. This is how it looks now. This is we're now about 7 to 8 months past, and you can see now the metatarsals have now healed with the bony cuts and osteotomies, and we have a much better parabola. Look how our parabola is here, how much longer the second, especially second and third metatarsals are, and here now our parabola is kind of is within normal range here. And I want to show you our patient. Here's our patient here, and she's now, if you notice today, she's back in her flip-flops, and here's how her foot is now. I'll point it out tomorrow. You can see now where we did the incisions on her foot right at the top here. You can barely see the incisions. And her toes now have a better attitude. We don't have this dislocation anymore of the second toe. She can now wear flip-flops and normal shoe gear without pain. And Martha's actually a friend of mine. I've known her all my life. We went to school together from first grade to 12th. Now, how's your foot doing now, Martha?
No pain.
So the pain is completely resolved? Good.
No problems.
So that, metatarsalgia is actually the most common foot deformity, and sometimes we try to avoid treating it. And minimally invasive surgery can tackle it fairly well if you allow the patients to know that it's going to be some recovery, but in the long run will help them quite a bit.